Welcome to Vitality VIP's Wellness Elite channel. Let's start.
Hi, I'm Dr. Mary. In today's video, we will be focusing on a very important organ, the thyroid. As more and more people are complaining about thyroid problems, in today's episode, I will present a list of symptoms that may indicate hypothyroidism. This disease affects approximately 5 to 10% of the general population, but its frequency increases with age. Moreover, many cases of thyroid diseases are undiagnosed. And one more information, hypothyroidism is much more common in women than in men. At the beginning, let's briefly talk about the thyroid and hypothyroidism. The thyroid is a small organ that weighs only about 20 to 30 grams, but its size does not reflect its importance to our body. It is a small organ with a big impact. The thyroid's task is to produce the hormones triiodothyronine, T3, and thyroxine, T4. These two hormones regulate the operation of virtually the entire body. They are responsible for proper metabolism, including regulating body temperature. They control the development of the nervous system, stimulate the heart to work, and contribute to bone mineralization. In addition, they regulate the menstrual cycle, affect mental efficiency and fertility. When the thyroid begins to produce too few hormones for some reason, we usually have hypothyroidism. As I mentioned, these hormones affect the functioning of the entire body, so when they are missing, it results in the occurrence of very many different symptoms, and that's what I'm going to talk about now. One of the most common symptoms of hypothyroidism is chronic fatigue, but it's not the typical fatigue we experience in our daily lives, such as after heavy physical work, intense mental activity, or a night without sleep. For many people, it is an exhausting and constant feeling of exhaustion that significantly hinders daily functioning. People with hypothyroidism often have trouble getting up in the morning, even after a good night's sleep. Another signal indicating low thyroid hormone levels and hypothyroidism can be an unexpected increase in body weight, which may not be related to increased food consumption and higher calorie intake. As I mentioned, thyroid hormones regulate metabolism. When there is a reduction in their levels, basic metabolism slows down. Simply put, our body expends less energy than usual under normal conditions. If we consume the same number of calories in our diet as always, it may turn out that our body does not use them and stores them as fat tissue. In addition, hypothyroidism can lead to water retention in the body, which also causes weight gain. Scientists believe that even a mild thyroid dysfunction can lead to significant weight gain and increase the risk of overweight and obesity. Of course, it must be remembered that our body weight depends on many different factors, and thyroid disorders are just one of them. People with hypothyroidism often also have a feeling of cold. For example, while most people wear short-sleeved shirts, people with hypothyroidism have the need to wear a sweater or hoodie. The intolerance to cold is due to the mentioned slowed metabolism. The human body needs thyroid hormones to produce energy, which is necessary to produce heat. As a result, people with hypothyroidism are more likely to feel cold and need to wear more clothes. Additionally, in some people, a decrease in sweating can be observed. When we are talking about skin, it is also worth mentioning that people with hypothyroidism sometimes experience swelling. This is caused by several factors. Firstly, the lack of thyroid hormones disrupts kidney filtration. When the kidneys become inefficient, fluid accumulation occurs in the body, resulting in the formation of swelling. Additionally, the lack of thyroid hormones limits the production of enzymes that break down molecules known as mucopolysaccharides, which are composed of proteins and sugars. Mentioned mucopolysaccharides, if not decomposed, accumulate in tissues under the skin and act like a sponge that absorbs fluid, which also leads to swelling. Furthermore, in people with hypothyroidism, circulation disturbances sometimes occur. Figuratively speaking, blood does not move at the proper pace, which can increase the risk of fluid accumulation in tissues. Swelling is usually located in the limbs, most often in the legs, but some people may also experience facial and eye puffiness. I will also immediately add that an enlarged tongue is also a symptom of hypothyroidism. Professionally, this state is referred to as macroglossia. The cause of an abnormally large tongue is excessive accumulation of mucopolysaccharides, which I mentioned a moment ago in the context of limb and facial swelling. Among the symptoms of hypothyroidism, hoarse voice should also be mentioned. However, it should be emphasized that voice changes occur gradually and slowly, making them usually only detected in later stages of the disease. The hoarseness that occurs is due to fluid accumulation in the vocal folds in the absence of thyroid hormones. Additionally, in the course of the disease, the thyroid gland enlarges, which may be the cause of compression or even paralysis of the laryngeal nerve. Just now, I said that in hypothyroidism, an enlargement of the thyroid, also known as a goiter, is observed. This condition is also present in hypothyroidism and is characterized by swelling in front of the neck, located just below the Adam's apple. People with an enlarged thyroid may feel pressure in the throat area and may have difficulty swallowing. The formation of a goiter is due to a simple mechanism, which I will briefly explain. In order for the thyroid to produce hormones, which I talked about in today's video, it must be stimulated to act. This is pushed by another hormone called thyrotropin, TSH, which is released by the pituitary gland. When thyroid cells are stimulated to produce the necessary hormones, but due to a disease state, these hormones are not produced, then the thyroid is further stimulated. Unfortunately, it is unable to meet expectations and saves itself by multiplying more thyroid cells, which unfortunately are also unable to produce hormones. And it is precisely this growth of cells that manifests as an increase in the thyroid, a goiter. The current state of knowledge also shows that changes in thyroid function affect the perceived taste and smell. In one of the older studies conducted on a small group of people, researchers noticed that 39% of people experienced taste disturbances and 17% experienced smell disturbances. It is worth noting that the treatment of hypothyroidism restores proper taste and smell perception. Scientists have repeatedly proven that hypothyroidism can affect various cognitive functions. In people suffering from this disease, memory disorders and decreased concentration are usually observed. Behaviors such as, "I forgot where I left my car keys," or "I don't remember what I went to the second room for," are typical of thyroid problems. These symptoms are commonly referred to as brain fog or mental haze. Studies have shown that patients with hypothyroidism have difficulties with memory and cognitive function, but these symptoms can improve with proper treatment. It's important to note that not all people with an enlarged thyroid will experience symptoms, and not all symptoms can be attributed to an enlarged thyroid. If you have concerns about your thyroid, it's always best to consult with a doctor. They can perform tests and determine the best course of action for you. All of these changes are largely reversible with proper treatment. One of the symptoms reported by people with thyroid insufficiency is also constipation. They are caused by a slowed motility of the digestive tract, including the intestines. Few people are also aware that in women with thyroid insufficiency, menstrual disorders often occur. When the thyroid hormone level drops, this triggers further consequences that result in decreased production of hormones closely involved in the menstrual cycle and ensuring proper functioning of the ovaries. I am referring to follicle-stimulating hormone, FS8 for short, and luteinizing hormone, or LH. As a result, thyroid insufficiency can cause irregular periods or their complete absence. In addition, ovulation may be inhibited, resulting in heavy bleeding. It is known that thyroid hormones have a direct impact on the functioning of our heart and blood vessels, so it can be assumed that if they are lacking, our cardiovascular system will not function correctly. And that's exactly what happens in reality. People with thyroid insufficiency have a slower heart rate and a low pulse rate. It is believed that in people with thyroid insufficiency, the pulse is usually slower by 10 to 20 beats per minute compared to healthy individuals. In the course of this disease, there may also be narrowing of blood vessels and an increase in diastolic blood pressure. As a result, Untreated thyroid insufficiency can result in heart failure. A symptom and consequence of hypothyroidism is erectile dysfunction. Based on research conducted, it has been observed that as many as 60% of men suffering from this thyroid disease experienced erectile problems. It is also believed that men struggling with thyroid insufficiency are also more likely to experience sexual problems, including reduced libido and decreased fertility. As you can see, hypothyroidism can manifest itself in many different ways. As is often the case, some symptoms are not very specific and can be attributed to other diseases. However, if you notice several of these symptoms in yourself, such as chronic fatigue, constant feelings of coldness, and hair loss, it's worth taking this issue seriously. Many factors can lead to hypothyroidism, with a lack of iodine being one of the main causes. Unfortunately, the food we eat is often low in this ingredient. The most iodine can be found in seafood, fish, and seaweed, but these are not commonly found on our tables. We do have iodized salt, but it does not fully solve the problem. I know some people take large doses of iodine, but it's important to be aware that an excess of this ingredient can also lead to hypothyroidism. The most common cause of iodine deficiency and resulting hypothyroidism is Hashimoto's disease, which is an autoimmune disease of the thyroid. In this condition, our immune system, due to improper activity, destroys the thyroid. Hypothyroidism can also be a side effect of certain medications, including amiodarone, thalidomide, phenobarbital, phenytoin, carbamazepine, and NIP. The symptoms of hypothyroidism can also be caused by radiation therapy to the head and neck, treatment with radioactive iodine, and surgical removal of the thyroid, such as in the case of cancer. To diagnose hypothyroidism, a TSH hormone level test should be performed first. If its concentration is elevated, then the level of free thyroxine, FT4, should also be checked. A high level of TSH and a low level of FT4 are likely indicators of hypothyroidism. Hypothyroidism is still not diagnosed often enough, primarily because the accompanying symptoms, which I discussed in today's video, are downplayed. As a result, few people go to the doctor or directly for testing. I also know that many people simply do not know that such symptoms can indicate hypothyroidism and do not take any action as a result. I hope this video will change that a little bit and you will be more attentive to your body and take action in time. That's all from me today. Thank you for your attention and I will see you in the next video.